Hospitals across Maine are trying to figure out what has caused some type of cyber incident that is affecting their operations. Multiple hospital systems, including Central Maine Healthcare and Covenant Health, say they are investigating the size and the scope of what happened.
Chris Costa shows us why other hospitals are now taking action to protect their data.
We need to know more, but it's big.
It's unclear exactly what kind of cyber incident is happening or how widespread it is. This all started on Memorial Day. Staff at Covenant Health, which includes St. Mary's in Lewiston and St. Joseph in Bangor, say they noticed irregularities that impacted connectivity across the organization. They're calling it a cyber incident initiated by an outside group. They say they immediately discontinued access to all data systems in its hospitals, clinics, and more. Then, on June 1st, Central Maine Healthcare faced a similar situation. Staff say technicians monitoring the information systems at CMHC identified unusual activity within the system's computer software. That's when they shut off all IT applications and hardware, including network servers and phone systems.
As soon as you think there is anything going on, the first thing you do is shut it all down to prevent any more damage being done.
But this is having a ripple effect across hospitals all over the state. Leaders with Maine Health, the largest healthcare system in the state, say when they became aware of the incidents, their team cut off connections between its systems and those of CMHC and St. Mary's out of an abundance of caution. They say their other hospitals, like Franklin Hospital in Farmington and Stevens Hospital in Norway, are ready to handle any increase in patient volume due to the limited care at the Lewiston sites. They do not believe Maine Health systems have been compromised.
I have no idea what data has been, compromised at all. Hopefully no personal patient data, but that is why they're after us. They want that information and then they can use it for ransomware or for other things, nefarious things.
CMHC and Covenant are taking steps to help patients in the meantime. Central Maine Medical Center, Bridgeton Hospital, and Rumford Hospital are still receiving and treating patients. All physician offices and outpatient sites are still open, but some elective procedures may be rescheduled. Leaders with Covenant say patients should keep their appointments because the facilities are providing services as normal. They say they're actively investigating the incident and, quote, treating this situation with the highest priority. They say they've tapped the best-in-class companies to determine what happened and restore full system access as soon as possible.
It's a mad scramble to get back up and running. But even that we've seen with both of our incidents here in the last few weeks is that takes a while.
For News Center Maine, I'm Chris Costa.
So the key takeaway for patients: do not forego getting health care. Leaders with Covenant say they do not have a timeline for the completion of their efforts. Northern Light Health staff tell us there is no impact on their system. They are also waiting on a reply from the FBI.